Okay, go.
Okay, so this is Nugget, and he's an 11-year-old standard bred who has had a fractured jaw, which resulted in a bone infection. So he's had to have 3 weeks of intramuscular and intravenous antibiotics, and that, for most horses, is much more than they can bear. So we've had to use a range of techniques to try and keep him from becoming needle phobic and getting afraid. So we've got here a heat pack which we've been applying every day for 5 to 10 minutes on the swollen areas. You will get some swelling, and we've been alternating sites from, right side to left side of the neck, right pec, left pec, and just making sure that we really change those sites around. The other thing is to think about where your landmarks are, so just giving us an intramuscular injection, thinking about where the horse's vertebrae is. It's coming across here around this area, so we want to avoid the bones, we want to avoid the jugular and carotid arteries, the jugular vein here, and so the area that you're looking at is really this space here in that triangle. Now, because he's had so many injections, I can feel that there's a lump here, so I'm actually going to never inject into a site that you can feel that's bruised or painful before. Alright, so the other key thing is to keep this muscle as soft as you can. So with Jan's going to come around here, just keep his head a little bent to the right, and we will take the needle off the hub, like so. I'll give that to you. And he is getting a little bit annoyed about this now. I'll just give him a little rub in the spot. Okay, just so that he knows that I'm coming. And just gently push it into the skin. Well done. Now we want to check into that hub and make sure that there's no blood in there, which we can see that there's not. And then as an added thing, draw back on the needle. And now the thing that we want to do now is very, very slowly administer this injection. So if you can, it's great to be able to administer it over 2 to 5 minutes. Now I know that's a really long time, and a lot of horses just won't tolerate that. But it's one of the reasons that this little horse has been able to continue with his medication. Again, we're just going to ask him to soften his neck. There we go. So obviously injecting into a contracted muscle is much harder than into a soft muscle. So we keep the muscle nice and soft. Just slowly push this in. Now, if you've got to do 30 mils, initially we were doing 25 mils, and so we were doing 15 mils into one site and 10 mils into another. Now you don't have to remove the needle to be able to do that. Ooh. You can just withdraw it a little and shift it. Again, when you do that, draw back on the needle, make sure that you haven't hit a small vessel. And there we go. And just slowly infuse.
You might want to tell them about the penicillin.
Now, this is penicillin that we're injecting here. And penicillin, sometimes you can get a shock reaction. So if you do hit a blood vessel, you can get a bit of a shock reaction where the horse becomes very irritated, all of a sudden becomes very, very alert and can stumble. Now that is an indication that the medication's gone to the brain directly via the venous system, and you stop immediately, withdraw it, and try and avoid injury to yourself or your horse. Usually within 10 minutes it will change itself. It will resolve it, the issue will resolve itself. But in that time, the horses can become very, very distressed and not really conscious of what they're doing. So it's important to try and keep them from hurting themselves or you. So you'll note too that both myself and the handler are on the same side of the horse. That's an important thing to do, because if this horse decides to go wild, and he's really, you can see he's not a very crazy little animal. Then we're in a position to be able to keep ourselves safe. When you withdraw it, just take it gently out of the skin. Just gently rub that.
Put the heat on it again.
And you can see he's doing quite well, but there's a bit of lumpiness here. So we just kind of gently massage those and put a bit of heat on. Okay, and that's giving an IM injection.